Hey there, my name is Cloud, and this is me enjoying my runs and the best gifts of life with my ladies. You can say I'm passionate about running. Welcome to my channel dedicated to recovery, rehabilitation, and running. Thank you for joining me in this journey to recover from the big city and hopefully one day soon run again. Hey, how are you? Welcome to my channel and thank you for joining my reflections today. Um, Another day, another grind. Let's do this. You and me. All right. So, um, today I want to share with you um, three things that I really remembered that stood out for me right after surgery when I had the lobectomy, removal of the right lower lobe of my lung. But before that, um, for those of you not following my channel, you may not know what I'm doing here. But just a quick primer, I'm doing my circuit target rehab and recovery drills indoors. Hopefully the weather changes in the next few months that I can get back to what I enjoy a lot, which is running. I know I can't yet, but most likely walking and eventually running. That's the plan. That's the goal. But for now, circuit um, exercises and circuit rehab on these machines. A 3-minute interval on each machine. Finishing 2 sets of this for a total of 24 minutes. And resistance levels set up at about 70%. That's currently where I'm at. And the goal for doing these is to get as many of these every week. 4 is the target. 5 would be great. 5 times. And the goal is really just to develop the habit of the rehab recovery and regimen that I'm doing to try to get my wind back, try to get my first of all my cardiovascular and energy levels back, and then hopefully soon to be able to recover and regain my strength that I have lost a lot of since the surgery, the recovery, and the chemotherapy. But for today, I just wanted to share with you 3 things and 3 highlights that I really stood out for me right after my lung surgery. So, a few months ago, August 27th, I believe, was the date, I formally had a surgical procedure, a VATS, video assisted thoracic surgery, to remove the entire right lower lobe of my lung. And doctors say that's about 20 to 25% of my total lung capacity. So yeah, I'm winded. I'm gassed really easily, and literature would say you may potentially recover 90% of that back in about 9 to 12 months time. And it's only been about 3 months since my procedure, so I'm definitely in the thick of recovery. But remembering the surgery itself and what stood out for me within that first week of right after surgery is a few things. The first one is pain. I thoroughly discounted, the intense level of pain I might endure right after the surgery, and I really discounted it. I really did not think that I would have such a hard time with it, but in reality, I did, and it was only through a concerted effort to discuss with my nurses and the doctor at the hospital right after the surgery. And this is despite the fact that I had a video assisted thoracic surgery, which means, the holes are smaller. It's not an open chest surgery. It's laparoscopic. And despite of that, there was a lot of pain. And one of the things that I did was I discounted it prior to the surgery. I didn't think it was going to be an issue. I was wrong. It was an issue for me. And I only learned it after a day or two of really suffering that it could actually be managed properly. So hydrocodone and morphine shots with very close monitoring by the nurses got me through the first few days of pain. So pain management is something that I really needed to learn. So hopefully, when it's your turn, please be aware not to discount and not to be too confident about potentially your ability to endure pain. So that's number one. Number two, it kind of ties into the whole pain, is the fact that you need to sleep. You need to get as much rest, and that sounds almost cliche to say it, but if you've ever been in a hospital right after surgery, it is so hard to get sleep that you feel rested or rejuvenated. I don't know what it is about being in the hospital. And plus the fact that every so often, every hour or two or 3 hours or whatever the intervals that the nurses are following, they don't let you sleep because you're going to come in, they're going to test you, they're going to get something from you, they're going to draw blood, they're going to do pulmonary rehab, a respiratory therapist is going to come, you're going to have breathing treatments. And yes, even in the dead of night, at 2 o'clock in the early morning, somebody comes knocking. Hey, it's time for your breathing treatment. So sleep is and was a premium the first few days right after surgery. So my advice to you is, at any given time where you can steal a nap here and there, take it. Don't think that you should only just sleep when night comes, because I promise you, when night comes, you're not necessarily going to be able to sleep through the entirety of it. So during the day, get as much rest and sleep as you possibly can, because there's no guarantee you're going to be able to do that at night. And the third thing that I guess is worth highlighting and remembering is, the third thing that I really want to highlight to you is the incentive spirometer, the that small gadget device that they give you and would tell you to practice your breathing. And I implore you, I encourage you to get on it and really do it. And this is going to be very important and integral in your recovery, in getting your wind back, and being able to feel that you're not short of breath or winded, and that your lungs are expanding and recovering properly. And prior to my surgery, I thought about the importance of this, and I thought that I was going to be on top of it. And for the most part, I felt that I was, but in reality, I probably was only maybe 60% compliant, which is really bad. Your doctor will tell you need to do 10 breaths through it every hour on the hour, so if you're only counting 10 hours in a day, you'll be doing at least 100 breaths. In the grand scheme of things, that's not a lot. So it's very, very important that when your turn comes, to please stay on top of your spirometer breathing exercises, because prior to my surgery, I thoroughly intended that I would do it and really perform it, and only to realize that by the time everything was said and done, I probably was half or maybe 60% compliant of it. So at this moment in time, looking back, about 3 to 4 months after that surgery event, these were some of the things that I remember that stood out for me, and I want to share with you these 3 things, which is again, pain management. Make sure you have that conversation with your doctor to have a robust pain management program right after you leave the operating room. That's number 1. Number 2 is to make sure you have a good solid plan about how you're going to be able to sleep and rest throughout the first 4 or 5 days right after surgery, because that's going to be a challenge, and there's going to be more, I'm going to tell you. But in that first few days, sleep is going to be an absolute premium. And finally, the spirometer. That's going to be very important. So, thank you for hopping on board today and joining me in my reflections throughout the process of my recovery. And wherever you are, however you're doing, we're in this together. Thank you. Until I see you next time, have a great day. Bye.